Welcome to Healthy Living Channel. Here, we dive into essential topics that help you stay informed and prioritize your well-being. Like this video if you're interested in natural health remedies. And if you're new to the channel, be sure to subscribe and turn on notifications to stay updated with our latest content. In today's video, we will be discussing about 9 warning signs your kidneys are failing, plus tests to help you avoid dialysis. Did you know that over 88,000 people in the United States are currently living with end-stage kidney disease, ESKD, also known as kidney failure? When kidney disease progresses to this stage, it becomes life-threatening, and individuals either require a kidney transplant or must begin dialysis to survive. Without one of these treatments, continuing to live with ESKD is impossible. However, the likelihood of receiving a kidney transplant is quite low. More than 100,000 Americans are on organ transplant waiting lists, with about 87% of them in need of kidneys. Due to the limited availability of donor organs, approximately 70% of those with end-stage kidney disease rely on dialysis to stay alive. The financial burden is significant as well, with dialysis costing each patient upwards of $40,000 annually. Detecting ESKD early can drastically improve management and survival rates, yet the unfortunate reality is that many people with kidney failure don't recognize changes in their kidney function. Unlike some conditions, symptoms related to the kidneys are often subtle or non-existent in the early stages. For example, many individuals won't notice major changes in the volume, color, or odor of their urine. While some may wake up more frequently during the night to urinate, this is not a definitive sign of kidney failure. Being aware of the warning signs of kidney failure is crucial for early detection. In this article, we will walk you through 9 common symptoms of ESKD, providing you with the knowledge necessary to recognize potential kidney issues and take timely action. We'll also introduce essential medical tests so you'll be well informed when you visit your doctor for evaluation. The kidneys are vital organs responsible for filtering and cleaning the blood, removing excess fluids, electrolytes, and waste products. When kidney function deteriorates to the point where it can no longer effectively perform these tasks, it is referred to as end-stage kidney disease, ESKD, the most advanced and severe stage of chronic kidney disease, CKD. ESKD typically occurs after years of progressively worsening kidney function. This condition is particularly common in people with underlying health issues such as hypertension, high blood pressure, cardiovascular disease, and diabetes. ESKD is characterized by the buildup of toxins and waste in the blood, a condition known as uremia. When the kidneys can no longer filter out these harmful substances, they accumulate in the bloodstream, leading to a range of serious health problems. Understanding the symptoms of kidney failure is crucial for early detection and effective management. Below are 9 of the most common signs of ESKD that can signal severe kidney dysfunction. 1. Fatigue. One of the most frequent and early symptoms of ESKD is chronic fatigue. When kidneys are no longer functioning well, waste products and toxins begin to build up in the blood, which can cause a persistent feeling of exhaustion. Additionally, failing kidneys produce less of a hormone called erythropoietin, which plays a key role in producing red blood cells. The decrease in red blood cells can lead to anemia, further exacerbating feelings of fatigue. This combination of waste buildup and anemia can make everyday activities feel draining and challenging. Patients with other health conditions such as diabetes, high blood pressure, a history of heart attack, depression, or sleep disorders often feel even more exhausted due to the added strain on their bodies. To combat fatigue, physical activity has been shown to be helpful. Studies suggest that patients with kidney failure who engage in regular exercise experience less fatigue over time. Some doctors may also prescribe erythropoiesis-stimulating agents, ESAs, to increase red blood cell production and treat anemia, though the effectiveness of these medications in reducing fatigue remains a topic of debate. By staying alert to these symptoms and seeking medical evaluation early, you can improve your chances of managing kidney dysfunction and improving your quality of life. In addition to recognizing these signs, understanding the types of medical tests that can detect kidney disease is essential for preventing further progression to ESKD and avoiding dialysis. Stay tuned for the remaining 8 warning signs and further insights on kidney health in the next section. Remember to like, share, and subscribe to support our channel and stay informed about your health. 2. Muscle cramps in advanced kidney disease. Stage 5 CKD. Muscle cramps are a frequent and painful symptom for individuals in Stage 5 chronic kidney disease, CKD, also known as end-stage kidney disease, ESKD. These involuntary spasms, often affecting the legs, are primarily caused by an imbalance of electrolytes, specifically calcium, potassium, and magnesium, within the blood. In healthy individuals, the kidneys help maintain proper electrolyte levels, but when kidney function is severely compromised, this balance is disrupted, leading to symptoms like muscle cramps. One of the most common triggers for these cramps is alkalosis, a condition in which the blood becomes overly alkaline, often due to dialysis or kidney replacement therapy. When the blood's pH is too high, it disrupts normal electrolyte balance, contributing to cramps. Low magnesium levels, a condition known as hypomagnesemia, may also occur after dialysis, further increasing the likelihood of cramping. Potassium levels in patients with ESKD are typically high because the kidneys struggle to filter this electrolyte properly. However, in certain situations, potassium levels can drop too low, a condition called hyperkalemia. This can result from vomiting, diarrhea, certain medications, or the effects of dialysis, and is another cause of muscle cramps in people with kidney disease. Fortunately, there are several effective treatments to reduce muscle cramps in those with ESKD. One approach is to add magnesium to the dialysis solution, which has been shown to alleviate cramps. Additionally, your healthcare provider may recommend adjusting your medications to help better balance your electrolytes, ultimately minimizing the likelihood of cramping. 3. Swelling or edema. As kidney function declines and chronic kidney disease, CKD, progresses, another common symptom is swelling *, also known as edema. This typically occurs in the legs, ankles, and feet. When the kidneys are no longer able to efficiently remove excess sodium and fluids from the body, these fluids accumulate in the tissues, leading to noticeable swelling. Individuals with heart disease, impaired circulation, other kidney problems, or liver disease are particularly prone to developing edema. Doctors typically treat edema using diuretics, which are medications that increase urine output, helping the body expel excess fluid. In addition to medication, reducing your daily sodium intake is crucial. Limiting salt to around 2.3 grams per day has been shown to effectively reduce edema. Being proactive and recognizing the signs and symptoms of worsening kidney function, such as muscle cramps and edema, can significantly impact how you manage your health. By taking early action and working with your doctor, you can help slow the progression of CKD and improve your overall quality of life. 4. Loss of appetite and reduced food intake in advanced kidney disease. Loss of appetite is a widespread issue among people with advanced kidney disease, particularly in the later stages of chronic kidney disease, CKD. This symptom is largely due to the buildup of waste products and toxins in the bloodstream as the kidneys lose their ability to filter them out effectively. These accumulated toxins often lead to a decreased interest in eating, making it difficult for patients to maintain their nutritional intake. While a reduced appetite can develop in the earlier stages of CKD, it tends to become more pronounced as the disease progresses. The loss of appetite is not just due to the kidney disease itself, but can also be influenced by other factors such as oral and gastrointestinal problems, the side effects of dialysis treatment, and even mental health concerns like depression and anxiety, which are common in those coping with chronic illness. For individuals with both diabetes and CKD, the risk of appetite loss is even greater. Over time, diabetes can cause damage to the nerves that control how quickly the stomach empties, a condition known as diabetic gastroparesis. This condition can leave you feeling full much longer than normal, even if you haven't eaten recently. When you do eat, you may experience nausea, vomiting, or abdominal pain because the stomach is emptying food more slowly than usual. Failing to meet your nutritional needs can worsen CKD, making it even more important to manage your diet carefully. Your kidney specialist will likely provide specific dietary recommendations to ensure that you are getting the nutrients your body requires while managing your condition. In some cases, appetite stimulants, such as magestral acetate, may be prescribed to encourage eating. However, it's crucial to monitor potential side effects from these medications, which can include overhydration, excessive weight gain, and high blood sugar levels. Maintaining proper nutrition is essential in slowing the progression of CKD and preventing further complications. Working closely with your healthcare provider to manage your appetite and dietary needs can significantly improve your quality of life and overall health outcomes. 5. Persistent itching in end-stage kidney disease, ESKD. Constant itching, also known as pruritus, is a common and often distressing symptom for individuals with end-stage kidney disease, ESKD. It is particularly prevalent among those undergoing hemodialysis, with more than 40% of patients reporting this issue. In some cases, the itching becomes so intense that it disrupts daily activities and sleep, significantly impacting quality of life. Although the exact cause of pruritus in ESKD is not fully understood, several factors are believed to contribute to this uncomfortable condition. One of the primary theories is that increased levels of inflammatory molecules and immune cells in the blood play a key role. When kidney function declines, these substances accumulate, which can irritate nerve endings in the skin, leading to persistent itching. Another potential cause involves an imbalance in opioid receptors in the body. These receptors, which are responsible for regulating sensations like pain and itchiness, may become dysregulated in individuals with kidney failure, further aggravating pruritus. Additionally, the buildup of toxins and electrolytes that would normally be filtered out by healthy kidneys can also contribute to this problem. For example, excess phosphorus or other metabolic byproducts might accumulate in the bloodstream, triggering skin irritation. To manage pruritus, doctors have several treatment options. One approach is to adjust the dose or frequency of dialysis to improve the removal of toxins that may be contributing to the itching. Medications such as gabapentin or pregabalin are often prescribed, as they are thought to help modulate the nerve signals responsible for itching. In more severe cases, additional treatments like phototherapy, which uses ultraviolet light to treat the skin, or opioid receptor modulators, which help balance the receptors involved in the itch response, might be recommended. These therapies aim to reduce the intensity of the itching and improve the patient's overall comfort. Understanding and addressing pruritus is crucial, as effective management can significantly enhance the quality of life for those living with ESKD. 6. Shortness of breath in severe kidney disease. Causes and management. Experiencing shortness of breath, medically known as dyspnea, can be alarming and is a serious symptom commonly seen in individuals with advanced kidney disease. This shortness of breath has several potential causes, often linked to the fluid, electrolyte, and protein imbalances that occur as kidney function deteriorates. One major cause of dyspnea in severe kidney disease is the accumulation of excess fluid in the body. When the kidneys fail to filter and remove fluids effectively, the excess water can build up in the lungs, a condition known as pulmonary edema. This makes it increasingly difficult to breathe, as the lungs become congested with fluid, reducing their ability to efficiently exchange oxygen. In some cases, lung scarring or pulmonary hypertension, high blood pressure in the lungs, can develop as a complication of chronic kidney disease, further contributing to breathing difficulties. These conditions stiffen the lung tissues, restricting airflow and exacerbating shortness of breath. Another significant factor is anemia, which often accompanies kidney disease. The kidneys produce a hormone called erythropoietin, which stimulates red blood cell production. When kidney function declines, erythropoietin levels drop, leading to fewer red blood cells. This reduces the oxygen carrying capacity of the blood, leaving the body deprived of adequate oxygen. As a result, the body compensates by trying to breathe faster and deeper, which can lead to the sensation of breathlessness. Inflammation plays an additional role in dyspnea. When chronic kidney disease leads to high levels of inflammatory substances in the bloodstream, it can further compromise lung function. In patients with protein energy wasting syndrome, a condition where malnutrition and inflammation cause the body to break down muscle tissue, including the muscles involved in breathing, the ability to inhale deeply can become impaired, leading to more severe shortness of breath. Managing dyspnea in kidney disease requires addressing its underlying causes. Respiratory support, such as supplemental oxygen, may be necessary in some cases. Additionally, doctors may adjust dialysis treatments to better control fluid levels, thereby reducing pulmonary edema. Treating anemia with erythropoiesis-stimulating agents can also help improve oxygen delivery and alleviate shortness of breath. Addressing malnutrition and muscle wasting through proper diet and possibly nutritional supplements can help support the respiratory muscles and improve breathing. Understanding the various contributors to shortness of breath in kidney disease can empower patients and healthcare providers to develop targeted strategies for treatment and management, improving quality of life and overall health. 7. Memory loss, confusion, and dementia in end-stage kidney disease. Understanding cognitive deficits, patients with end-stage kidney disease, ESD, may frequently experience cognitive issues, often referred to by medical professionals as cognitive deficits. These cognitive problems can manifest in various ways, including difficulty concentrating, memory loss, trouble with learning, confusion, and even dementia in more severe cases. One of the primary reasons for these cognitive difficulties is the accumulation of waste products in the bloodstream, a direct result of the kidneys no longer being able to effectively filter out toxins. These waste products, such as urea, can negatively impact brain function, leading to diminished mental clarity and memory retention. Over time, as the toxins continue to build up, the brain's ability to process information and make decisions becomes increasingly impaired. Another critical factor that contributes to cognitive decline in patients with ESD is the potential damage to the brain's blood vessels. This occurs due to reduced oxygen supply to the brain, which is often a result of anemia, a common condition in kidney disease. Anemia leads to a lower number of red blood cells, which are essential for transporting oxygen to the body's tissues, including the brain. The chronic lack of oxygen can damage brain cells, resulting in memory issues and confusion. Additional contributors to cognitive dysfunction include depression, sleep disturbances, and overall poor mental health. Depression is particularly common in patients dealing with the stress and physical strain of chronic illness, and it can further cloud mental functioning. Similarly, sleep disorders, which are common in people with kidney disease, reduce the brain's ability to rest and repair, leading to problems with focus, memory, and learning. Fortunately, there are ways to manage and potentially improve cognitive symptoms in individuals with ESD. One approach is intensive control of hypertension, high blood pressure, which has been shown to reduce the risk of mild cognitive impairment. Since high blood pressure can damage blood vessels, including those in the brain, keeping blood pressure in check helps protect cognitive function. For some patients, a kidney transplant can lead to improvements in brain function. After the surgery, the kidneys can begin to effectively filter waste again, and many patients report better memory and overall mental clarity following a transplant. While not every patient is eligible for a transplant, those who undergo the procedure often see significant improvements in their cognitive health. In summary, Cognitive decline in ESD is multifactorial, resulting from toxin buildup, anemia, and related health issues like hypertension, depression, and sleep problems. Managing these contributing factors is key to preserving mental function and improving the quality of life for patients with kidney disease. 8. Urine-like breath and abnormal taste. Understanding uremic factor in end-stage kidney disease. In patients with end-stage kidney disease, ESD, a distinct symptom called uremic factor can occur, leading to a urine-like odor on the breath. This condition arises because the kidneys, when functioning poorly, fail to filter and eliminate waste products through urine. As a result, these toxins and waste substances, particularly ammonia, build up in the bloodstream and cause this characteristic breath odor. Additionally, many patients with ESD experience an abnormal or metallic taste in their mouth, a condition known as dysgeusia. This unpleasant taste is closely linked to the same underlying problem, the accumulation of waste products in the body. When the kidneys are unable to properly filter the blood, the composition of the saliva can change, leading to alterations in taste. Specifically, imbalances in fluid, electrolyte levels, and the buildup of toxins contribute to this phenomenon. The increased presence of certain chemicals in the saliva can make food taste metallic or strange, and in some cases, this symptom is severe enough to reduce the patient's appetite or alter their eating habits. Another cause of this abnormal taste sensation relates to the acidity and flow of saliva, which may change due to the kidney's reduced ability to maintain proper balance in the body. These disruptions in normal saliva production can exacerbate the unpleasant taste, making it difficult for patients to enjoy food or maintain good oral hygiene. To manage these symptoms, patients can benefit from using bicarbonate-based mouthwash. This specific type of mouthwash has been shown to neutralize the bad taste that results from the accumulation of waste products, offering relief from dysgeusia. Additionally, maintaining good oral hygiene is crucial, as poor oral health can worsen the taste problems experienced by patients with kidney disease. It's also recommended that individuals with ESD seek a dental checkup to ensure their oral health is in good condition. Because poor kidney function can impact various aspects of the body, including the mouth, regular dental visits can help identify any oral issues that may be contributing to the unpleasant taste or breath odor. Addressing these problems can significantly improve a patient's quality of life and overall well-being, especially as they manage the complex symptoms of kidney disease. 9. Skin changes in end-stage kidney disease. A detailed overview. In patients with end-stage kidney disease, ESD, skin changes are prevalent and can significantly affect appearance and comfort. Approximately 40% of individuals with ESD experience noticeable skin discoloration, which may manifest as paleness or a dull complexion. This discoloration is primarily a consequence of anemia, a common condition in kidney disease where the body lacks sufficient red blood cells to carry adequate oxygen, resulting in poor skin tone. Conversely, some patients may develop hyperpigmentation, characterized by darker patches on the skin. This condition often stems from hormonal imbalances associated with kidney dysfunction. Addressing anemia through treatments that increase hemoglobin levels can often help improve overall skin appearance. For those dealing with hyperpigmentation, using sunscreen is crucial as it can prevent further darkening of the skin when exposed to sunlight. Additionally, patients with ESD often exhibit a yellowish tint to their skin. This yellowish hue results from the accumulation of certain substances that normally contribute to urine color. Another common skin issue in ESD is xerosis, or very dry skin. This dryness can be uncomfortable and is believed to result from the shrinking and reduced functioning of the skin's oil and sweat glands, leading to insufficient moisture retention. The exact mechanism behind xerosis is not fully understood, but the loss of these glandular functions likely contributes to the dryness experienced by many patients. To alleviate this condition, it is recommended to reduce the frequency of washing, such as showering and bathing, use moisturizing lotions, and avoid irritating fabrics. These measures can help maintain skin hydration and improve overall skin health. If skin changes become severe or bothersome, patients should consult a dermatologist who can offer tailored treatments and advice to enhance both appearance and comfort. Early detection of kidney disease is critical for effective management and can significantly alter the disease's progression. There are several key tests that healthcare providers commonly use to diagnose kidney issues before they escalate into more severe conditions. 1. Serum creatinine level. This blood test measures the concentration of creatinine, a waste product produced by muscle metabolism. Elevated creatinine levels often indicate impaired kidney function and serve as a primary marker for kidney disease. The results are also used to calculate the glomerular filtration rate, GFR, which assesses how efficiently the kidneys filter blood. Consistently high creatinine levels alongside a low GFR can confirm a diagnosis of chronic kidney disease, CKD. 2. Blood urea nitrogen, BUN, level. Another important blood test, BUN measures the amount of urea nitrogen in the blood. High levels of urea nitrogen can signal that the kidneys are not effectively filtering waste from the bloodstream. 3. Urine protein level. Testing for proteinuria, or the presence of protein in urine, is crucial for diagnosing kidney disease. Healthy kidneys typically excrete minimal protein, so the detection of excess protein can indicate dysfunction. 4. Ultrasound. This imaging technique utilizes sound waves to create visual representations of the kidneys, allowing for the detection of structural abnormalities or irregular blood flow that could predispose patients to CKD. Managing end-stage kidney disease, ESD, necessitates a combination of treatments tailored to the individual's specific condition and its severity. Here are the 4 primary treatment options. 1. Medications. Medications play a vital role in managing chronic kidney disease, including ESD. They help control symptoms and complications. For instance, antihypertensive medications help regulate high blood pressure, while diuretics promote urine production to reduce fluid retention. Additionally, erythropoiesis-stimulating agents are prescribed to address anemia, and anti-hyperglycemic drugs help maintain normal blood sugar levels in diabetic patients. 2. Kidney transplant. A kidney transplant is often considered the preferred treatment for ESD. This procedure involves replacing a damaged kidney with a healthy one from a donor, eliminating the need for dialysis. Transplants generally offer improved longevity and quality of life compared to dialysis and are associated with a reduced incidence of cardiovascular diseases. However, this option requires finding a suitable donor match, and the patient must take immunosuppressive medications to prevent organ rejection. 3. Ethical considerations regarding organ transplants. It is essential to highlight the concerning practices surrounding organ transplants, particularly in places like China, where reports of illegal organ harvesting without consent have surfaced. In these cases, organs are often sourced from prisoners or marginalized groups, raising significant ethical issues. Potential transplant recipients are advised to avoid seeking transplants from these regions to prevent inadvertently supporting such practices. 4. Lifestyle adjustments and supportive care. Alongside medical interventions, lifestyle changes and supportive care play crucial roles in managing kidney disease. Patients are encouraged to maintain a balanced diet, control blood pressure and blood sugar levels, and engage in regular medical checkups to monitor their condition. By understanding the range of symptoms, diagnostic tests, and treatment options available, individuals with end-stage kidney disease can work with their healthcare providers to effectively manage their condition and improve their quality of life. In this discussion, we explored various treatment options for patients suffering from chronic kidney disease, CKD. Medications play a critical role in managing the symptoms and complications associated with CKD. These medications can often be initiated in the early stages of the disease. However, it's important to note that they do not restore kidney function, especially in more advanced stages of CKD. When kidney function declines to a critically low level and cannot be adequately controlled with medications, dialysis becomes necessary. This process is vital for patients in the later stages of kidney disease, as it artificially filters waste products from the blood, compensating for the kidney's reduced ability to perform this function. However, dialysis is considered a temporary measure, not a permanent solution. In contrast, a kidney transplant is the most definitive treatment for ESD, offering a more permanent restoration of kidney function. This procedure replaces the damaged kidneys with a healthy donor kidney, but it involves complex surgical procedures and requires careful post-operative care, including lifelong management to prevent organ rejection. While these medical interventions are crucial, the safest and most effective long-term strategy for managing kidney disease involves making lifestyle changes. These changes should be tailored to individual needs and can include dietary modifications, regular physical activity, and effective management of risk factors such as diabetes, high blood pressure, cardiovascular disease, and obesity. Implementing a kidney-friendly diet, ensuring proper fluid intake, and maintaining an active lifestyle can significantly delay the progression of CKD and reduce the need for more invasive treatments. Understanding these principles empowers patients to make informed decisions regarding their health and quality of life. Regular follow-ups with a kidney specialist are essential for monitoring the condition and receiving appropriate care throughout the treatment journey. As we conclude this video, the key takeaway is that recognizing and understanding the symptoms of end-stage kidney disease, ESD, can significantly enhance your quality of life. Early detection and proactive management of symptoms, such as fatigue, itching, swelling, or shortness of breath, can facilitate a more comfortable living experience with the disease. Maintaining close communication with your kidney specialist and adhering to their guidance on treatment options and lifestyle changes, whether through medication, dialysis, or dietary adjustments, can lead to meaningful improvements in your health. We hope this information proves beneficial to you or your loved ones as you navigate the challenges posed by kidney failure. A heartfelt thank you goes out to our current subscribers and viewers. Your support motivates us to keep sharing valuable insights. Remember to hit the bell icon and activate notifications to ensure you never miss a life-saving video. Stay informed and prioritize your health.